We're going to spend the rest of the session taking your questions. Please send all your questions to us via the WebEx chat now. We're going to take some time to review your questions and answer them. Okay, we have a question. Can you show us how to export to Excel? Yes. Wherever you see the blue download CSV link in the upper right corner, means you can just click on that, and then you'll get a pop-up warning you that you're about to download PHI, so make sure that you're not saving into a public computer, for example. And then you hit confirm, and then it downloads. You can open it up in Excel from wherever your computer saved it to. So you can download the summaries into Excel. You can download the detail into Excel if you are in a detailed level report. Okay, we have another question. Where are the videos exactly? They're under the health dropdown. There's going to be a video link in the actual non-demo version of the BTQ portal. Okay, we have another question. For members with 3 months of outreach in a 6-month period, if you discharge the members in the system, will that remove the tracking error? No. So discharging a member means you're no longer working with them. If the work that you have already reported caused an issue, reporting that you're no longer working with the member doesn't solve the issue. So for example, if you reported that you did April outreach, but another health home already had the member in outreach from January to March, that would be a 4th month. The state doesn't allow that. If you stop working with the member, that doesn't fix the issue. You've already reported the 4th month of outreach. The only way to fix it is the other health home has to delete their outreach, or you have to delete your outreach that you've already sent. If you need any assistance with that, you can just contact our help desk, hhsupport@btqfinancial.com, because the process for doing that does depend on which health home you're in.
Hello, so we have a question about patients who go from outreach to enroll, later in the same month. Because we do bill each week, that does require that we void the claim and rebill. Your only responsibility would be to make sure that you complete the documentation and your EMR completely, fill out your HML, and then that will come in automatically, and we will do the rebilling on your behalf once we process the void. So there will be a little bit of a delay, and then we need to make sure the void goes through, then we would rebill on your behalf. Another question, yes, once that comes off the missed claims report, anything that ineligible become eligible, it's rebilled. That will update the missed claims report. Hello, we have some questions about the various instances whereby 4 visits are necessary to bill at the higher rate, namely adult home and HH+. The HH+ actually has been built into the HML to, advise if the 4 requisite visits have occurred. The adult home does not, believe it or not. We have reached out to the state and asked if they can update the HML, if this was an oversight or, if there's any plans to do so. For now, we're actually working with the health home leads who are determining that, working with the CMA and attesting to us that the 4 visits did occur, and we're going ahead and billing that. So hopefully we'll get some more information from the state, make that a little bit easier, put it right into the HML. But for now, we're doing HH+ would be through the HML, and the AH+ would be through the health home lead.
All right, we have another question regarding adding in multiple HMLs. So, for instance, if you add an HML at the beginning of the month and then you need to change something and you add one at the end of the month, then yes, it will automatically void the first one and we will add the second one. Please do keep that in mind so you're not sending the same HML, because it will void the first one submitted. And the last one submitted will be the one of record.
We have another question about the go live December 1st, date of service. Date of service 12/1 on will be BTQ billing under these new rules, under the health home. Anything prior to 12/1 can be billed by the CMA under the legacy rules, so keep that in mind.
We have a question here about the number of HMLs per health home for a specific CNA. I think the question is asking if you want to be able to see how many of your members fall into the high category versus the medium versus low category. And you can actually get that information on the patient list. If you pull up the patient list and you download the CSV, as Ben was showing us earlier, from here, you can actually download the enhanced roster. And on the enhanced roster in column AO, it will show you the HML category that your members fall into. Also, right next to that category is next to that column is a very helpful column which will show you the Medicaid end date. So if you want to plan ahead and recertify your members, you can also get that information there. So again, you'll navigate under patient management to patient list, download the CSV, the enhanced roster, and then you'll be able to download the CSV and filter over for column AO and AT.
Hello, we have a question. We hope that this would be a rare scenario, but that you've attested through the HML or through the health home that you have seen the patient on the 4 requisite visits, but then it turns out, for whatever reason, one of them were not eligible as part of those 4 visits. Then yes, the same thing would apply. We would need an updated HML, or the health home would need to let us know that the visit wasn't valid in the case of the AH+, and then we would go ahead and void it, and then we would bill at the health home rate. So it's the same thing. Everything in those programs goes through the HML, or until they update the adult home, we would need to be notified through the health home lead.
All right, there's a question regarding being able to sort your patients by care coordination and ACT teams. Currently, there is not a way to sort using the enrollment file or the patient list to sort your members. We are looking at a way to do that. Currently, we're focusing all of our efforts on building the child health home into the portal and separating, sorting those members. The best way to be able to sort your members effectively would be to have a separate MMIS ID for your ACT team. However, in the meanwhile, we will continue to search for a way to differentiate among your members in the BTQ portal. All right, so no more questions are coming in. We're going to go ahead and end our training for the day. We really appreciate your calling in, and we will be having another training next Tuesday. Thank you all very much for your time. Feel free to send us any other questions that come to mind to hhsupport@BTQ Financial, and we will look forward to working with you all closer in December. All right, have a great day. Bye-bye.